Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A patient with bipolar 1 disorder is currently being managed with lithium 600 milligrams q.h.s. along with quetiapine 300 milligrams daily. The patient presents today for follow-up and reports that her mood has been very stable. Her work as a pastry chef has been really stressful around the holiday season, but she's handled it well and has no concerns about any mood deviations, either manic or depressive. She's sleeping approximately 7 hours nightly. Her last blood work was 7 months ago, and at that time there were no alarm findings in her lithium level renal function tests, TSH, or liver function tests. On physical examination, the psychiatric mental health nurse practitioner appreciates a fine, symmetrical tremor of the hands that gets worse when the NP asks her to write her name. This finding was not present on previous examinations. The NP should take which of the following actions? So this question really is about not just making a diagnosis here, but developing an evidence-based plan of care. Which action should you take given these circumstances? It's your classic analysis and application question. You are presented with a set of circumstances. You are required to draw a conclusion and then act on it. So let's look at the answer choices here, and then we'll talk about the conclusion and the action. Given these circumstances, should the NP draw a TSH, lithium level, and metabolic panel with an EGFR in the office today? Or should the NP instruct the patient to proceed to the emergency room immediately? Or hold the lithium and order a lithium level to be drawn in 1 week? Or hold the quetiapine and order a metabolic panel with an EGFR to be administered or to be ordered in 1 week? All right, so let's go back to the question here and draw the conclusion. We know the patient has bipolar disorder. We know the patient is on 600 milligrams of lithium at night and quetiapine 300 milligrams daily. She has been stable. She has no complaints, even though there are some stressors going on at work. She's sleeping well. Her last blood work 7 months ago was fine. There were no alarm findings. Her lithium level and renal function tests, as well as TSH and liver function tests, were all normal. So that's the background. Now today, on examination, even though she has no complaints, even though she's doing well at work, despite the stressful circumstances, the NP notices a physical examination finding of a fine symmetrical tremor of the hands that gets worse when the NP asks the patient to write her name. All right. So we know that a tremor that gets worse when the patient is asked to write her name is a physical finding, it's a neurological finding, and in the setting of lithium, there is concern about lithium toxicity. That's the issue here. The conclusion that you need to draw is there a potential for lithium toxicity. This is an early indicator of that. Given that, would you draw a series of blood work today, including the lithium level, the metabolic panel, which will include a renal function test, the GFR, which is your clearest measure of renal function in this setting? Would you draw those in the office today? Or does the patient need to go right to the emergency room? Or hold the lithium and then do a lithium level in a week? Or hold the quetiapine and order a metabolic panel? Well, since, hopefully we can agree there's concern here about lithium toxicity. So right off the bat, you can get rid of D. The quetiapine is not the concern. The lithium is the concern. Given all of these circumstances, A is the correct answer. A is the best answer of those provided. A fine bilateral hand tremor is an early indication of lithium toxicity, and it definitely needs to be evaluated immediately. But if office-based labs are available today, an ER visit is not necessary unless there are other acute symptoms of lithium toxicity, and that's not presented here. There is no other discussion of acute symptoms of lithium toxicity. Now, if the tremor were severe and there were other symptoms of lithium toxicity, like the patient was confused, had difficulty speaking, ataxia, involuntary muscle spasms or twitching, severe nausea, vomiting, changes in vision, like those are other symptoms that, along with a pronounced tremor, would constitute an emergency. But she doesn't have any of that. Even the tremor itself, if it was profound, if it was a serious, profound tremor, that would constitute an emergency. So, because all you see is a fine tremor that gets a little worse, gets worse with purposeful movement, you do need to evaluate this level today. And if office-based labs are available today, that is fine. Now, B is not the correct answer in this scenario because the tremor is not severe and there are no additional symptoms. Now, if the tremor was severe or there were additional symptoms like those I just rattled off, then B would be the correct answer. But in this scenario, it's not. And C is certainly not the correct answer. I mean, it's not about holding lithium and checking in a week. This lithium level does need to be evaluated now. And again, A is appropriate, assuming you can draw the labs now. And like I said, D is not the correct answer because quetiapine, now antipsychotics, of course, they can cause extrapyramidal symptoms, which can include a tremor, but it's a different kind of tremor. We're not worried about this here. With quetiapine or any second generation antipsychotic for that matter, if that was the cause of the tremor would actually be a little bit different in character. Tremors due to antipsychotics actually get better. They are alleviated by purposeful movement. They're worse at rest and they improve with purposeful movement, kind of like a Parkinsonian tremor. But in the setting of lithium toxicity, the tremor gets worse when you try to do something like write your name. So for all of those reasons, clearly in this circumstance, A is the correct answer because you can draw the labs today. But I do want to be very clear in this point. Well, there's a few points that I think this question makes clear. Number one, if the tremor is a new onset like it wasn't there before, it's a concern. If the tremor is a fine tremor at rest and worse with purposeful movement, lithium is the potential culprit. Lithium is the concern. If this is all that's going on and there's no other neurosymptoms, it's not an emergency room an emergency. It's a draw labs today situation. Point number two, if the same kind of tremor is present, but it's either very severe or there are those other symptoms I managed, then it goes to the emergency room. And then finally, if the patient has a tremor that's new, but it doesn't get worse with purposeful movement, it actually is alleviated by purposeful movement, then the concern is more that it's due to the antipsychotic. And then the answer then is to stop the antipsychotic.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.